Hello everyone, this is Vamshi Krishna. Today we will see some of the a basic first aid multiple choice questions. Okay, so the first question is the most important aspect of hand washing. So as a nurses, as a medical profession, we should know what is the basic purpose of hand washing. Okay, so while doing hand washing, what is the most important aspect? The options are time, friction, soap, and water. So, among these four options, which is the most important while we doing hand washing? Is it time, friction? Is it soap? Based on the soap, the hand washing most effective, or based on the water, whether it is cold water, hot water? The right option is friction. So while we're doing hand washing, we need to rub our palms very tightly. Then only the infected or microorganisms which are present on the hand, it can be removed. That is friction. So the right option is friction. While doing the hand washing, the most important thing is the friction, not a time or soap or water. So the next question is the introduction of drugs or fluids. Okay, the introduction of drugs or fluid into the bone marrow. So when we insert or when we give the any medications or any fluid into the bone marrow, what we call? Options are intrathecal, intraosseous, intracardiac, intradermal. So what is the meaning of when we give the any medication into the bone marrow? That is, the right option is intraosseous. So intraosseous is nothing but giving the medications into the bone. Okay. So intrathecal is nothing but it is giving medications to the brain or meninges, spinal cord meninges, and intracardiac is nothing but giving to the directly to the heart, and intradermal is the skin. So the next question is 1 liter of normal saline equals to how many pins? Okay, you just remember this pins. How many pins of 1 liter of normal saline? Whether it is 5 pins, 6 pins, 2 pins, or 4 pins. The right answer is the 2 pins. So 1 liter is equal to 2 pins. The next question is introduction of solid form of drug into the body orifices is termed as. So here the question is body orifices. Body orifices nothing but openings. The options are lodging, insertion, installation, none of the above. The right option is insertion. So insertion is nothing but giving or administration of solid forms of drugs into the body orifices is called insertion. So lodging is nothing but it is stagnation of some fluid or something. Installation is nothing but giving medications to the eye and ear. That is the installation. So the next question is the most preferred IM injection in neonates. So in the case of neonates, where we can give the IM injection, what is the site? What is the most preferred site for giving IM injection in the neonates? The options are deltoid muscle, ventrogluteal muscle, dorsogluteal muscle, vastus lateralis. So which is the most preferred IM site for the neonates? The right option is vastus lateralis. So the vastus lateralis we can see in the image. Here we have the lateral femoral condyle, okay, and greater trochanter. So between these we can give the IM injection is here. Why? Because in the neonates these muscles are bigger. Okay, so here only we can give the IM injection in the case of neonates. So the next question is 1 liter of NS equals to how many quarters? So previously we have seen the pins. Okay, so here I am asking how many quarters. The options are 5 quarters, 6 quarters, 4 quarters or 2 quarters. The right option is 5 quarters. So 1 liter of normal saline equals to 5 quarters. So the next question is which of the following is not the function of police in disaster? So in case of some disaster, there we have seen a policeman. Okay, so what is the not not the function of policeman during the disaster? The options are maintaining law and order, assisting in rescue operation, or guarding the dead or and injured, keeping their record, and rehabilitating affected person. So please understand the question. Here I am not asking the function of police in the disaster. I am asking what is not the function. That is except one. The right option is option D. So he cannot do the he cannot give the any treatment or any first aid for the affected persons. He cannot send the a person to the rehabilitating centers or any hospitals. So his duty in the disaster only maintaining the law and order and a rescue operation and guarding the securing the patients or injured persons in the disaster, but he is not doing the rehabilitating of the affected persons. So the right option is D. So the next question is which of the following is a sign of death? So you have seen a person, he is unconsciously fell down on the floor. So by saying among these options, how we can say the person is death? Correct. The first option is absence of breathing, no heartbeat, dilated pupil, and rigor mortis. Rigor mortis is nothing but stiffness of the muscles. Okay, stiffness of the muscles. Option D is all of the above. So which is the right option? Option D. So in the case of dead person, we can see absence of breathing and no heartbeat and dilated pupils. When we lighten the torchlight into the pupil will not react towards the light and stiffness of the muscles will be there. So the right option is all of the above. So the next question is when a person is drowning in the water. Okay, some one person has fell into the water from the boat. Okay, so for example you are in the boat. Okay, so what you will do when the person is fell down into the water? The options are take a selfie video with a cell phone, whether you take a video with a cell phone or jump into the water even you don't know the swimming. So you don't know swimming even though you want to save the person who are in the drowning position. So what you will do? And the next option is throw a life jacket. Okay, life jacket will be there in the boat. So or call for help. Okay, calling or shouting for help even there is no one. Okay, so what you will do at the time of in this situation? The better option is throw a life jacket. Okay, so when the person is drowning, we need to throw a life jacket or any rope or any tube like that, which can save the person in the water. So the next question is, the person is suddenly affected by choking while eating. So commonly we will see some of the people are getting choked by while while they are eating. So at the time what you will do? Call for help, make a person in a high falls position, or Heimlich maneuver, your whether you do the Heimlich maneuver or whether you will start the CPR. So at that, in this situation, what you will do? So you have to do the Heimlich maneuver. So the right option is Heimlich maneuver. So what is the Heimlich maneuver? The Heimlich maneuver is a performed by wrapping your arms around the person means affected person, and making a fist with one hand and clasping it with the other. Okay, so we need to fix the one hand and we need to hold the other hand, and you place your fist between the person's rib cage. Okay, affected person rib cage and belly button, and thrust your hand into their abdomen until the object is freed. Freed is nothing but coming out. So here you can see the picture. So here the person is choking, and another person, he is standing back of the person and holding his hand and pressing over the rib cage and abdomen. So when we give the pressure over here, what will happen? The object which is present in the throat, okay, in the neck region, by doing this pressure, it can come out. So this is called Heimlich maneuver. So the next question is, how should you open the airway of unconscious patient? So in the case of unconscious patient, they will have the breathing difficulty due to the backflow of the tongue. So what you will do at the time? Head tilt and chin lift, jaw thrust, head tilt and jaw thrust, lift the chin. So which is the best method to open the airway in the case of unconscious patient? The right option is head tilt and chin lift. So we have to do this method. Okay, in this method, the nurse or any medical person, he is downing the head and up lifting the chin region. Okay, so by this the air can go into the lungs very easily. So the next question is, which is the correct ratio of chest compressions to rescue breaths for use in CPR of an adult patient? So what is the normal ratio of the breath and compressions? The options are: option A 2 compressions 30 rescue breaths, 5 compressions 1 rescue breath, 15 compressions 2 rescue breath, 30 compressions 2 rescue breath. So what is the correct option? Option A. So we need to give the two sorry, this is not right, wrong answer. This is the right answer. 30 compressions and 2 rescue breath. So we need to give the 30 compressions. For each 30 compressions, we have to give the artificial breathing. So the right option is option D. The next question is, which of the following can cause stroke? So among these 4 options, which is the cause for occurring of stroke in the patient? Options are: option A blood clot in an artery of the brain, a blood clot in the artery of the heart, a blood clot artery in the leg, or a blood clot in the artery of the lungs. So which can cause the stroke? The right option is a blood clot which is present in the artery in the brain. So when the clot is nothing but agglutination blood. Okay, When the blood is clotted, it will become a hard structure. When it is go enter into the brain, near to the brain, so if it is present in the artery, what will happen? It will stop the blood circulation to the brain. What will after the cessation of blood to the brain, what will happen? The person go to the stroke stage. So the right option is option A. The 14th question is, which medical condition will develop from severe blood loss? So when the patient having severe blood loss, what will happen? Options are shock, hypoglycemia, anaphylaxis, hypothermia. So what will happen when the patient is having severe blood loss? So the patient will go, they may affect to the shock. Okay. So when the person having the a loss of blood, so he will become dehydrated. So due to that reason, the patient go to the hypovolemic shock. Hypovolemic shock is nothing but reduction or reducing of body fluids in the body. The last question is, what is faint? Okay, commonly we will heard some patients are feeling faint. So what is the meaning of faint? Options are a response to fear, an unexpected collapse, or a brief loss of consciousness, or a sign of flu. So what is the right option? Option C is the right one. So when the person having a temporary uh, unconsciousness, that is called fainting. Okay, fainting is nothing but loss of consciousness for a temporary, not a permanent. That is called faint. So this is the end of the class. Thank you guys.